I'm Joanne Durbon. I'm Director for School-Based Health Centers for Christus Cabrini, and we have 17 centers in 5 parishes. We provide physical and mental health services within a school setting to the students within that school. Daily we have a registered nurse, a mental health provider, and a secretary, and then I have nurse practitioners and PAs who rotate through the 17 centers to provide advanced care, and I have 3 medical directors for the 17 centers. This opportunity to provide dental services within a school setting, we were asked if we would be interested from Dental Caravan from Chicago. And so there was a grant, there was an opportunity from Oral Health of America. And so we got to talking, and this is a service we had been seeing as being missing from School-Based. And we do all the physical care, providing counseling services, but we had so many kids with dental problems, not having any dental services, some never even seen a dentist, they might be in high school. We've had students with no front teeth because they just had no care through their life and their adolescence, and very traumatic for an adolescent. So we decided this is something we wanted to do. So we wrote the grant to Oral Health of America. We received that grant, Christus Cabrini School-Based did. And we actually work with Dental Caravan. They bring portable equipment into the school setting. We get permission from the parents for the program. So they come in with their dental equipment. They set up the chairs. They do a little education program for the students. They do some x-rays. They do a cleaning. And they do a visual and assessment of the student as well of their teeth. And then if they are able to, they provide sealants to those students for their teeth. And then if they need restorative care, like if they have cavities, then they refer them to the dentist and get those done and follow up to make sure they went. We're going into our 20th year with School-Based. Teresa and I have been working very closely for 20 years doing the little extras that we just didn't have the monies for. And it's been a big benefit. I have many stories that I've been collecting through the years of the things that we've done to help kids that if CMN had not been here, we couldn't do. This young mother, she's a single mom. She was an intern in our School-Based Health Center. We often have nursing students who come into the centers. We work in the community with that, and also with social work interns, and she's a social work intern. And she was working at our Clutcherville School-Based Health Center, and she knew about the dental program, and so her child is a kindergartner there. And so immediately she said, I want this done, because she said, I don't know when I would be able to take off work. I'm a single mom, I'm in school trying to make ends meet. She said it might be months before I could get him in, so she immediately said, I want to be part of this program.
They provided sealants, they did x-rays and just a general cleaning, and then afterwards they sent home like a letter just saying what they've done and just to follow up with my primary care dental. Being that I was a student, a single mom, it was very hard for me to try to take off of work to actually get him to see a dentist. And so that part for me was important because it was just right there in the school. And I feel that had they had not come to the school, I would have probably have to wait maybe during the summer, till the summer, to get him to the dentist.
We have between 10 and 11,000 kids that we serve. We serve anywhere, usually around between 35 and 40,000 visits per year with our mental health, physical health services, and that's not even counting the dental. Since March, just in the few centers that we finally had all the details in place by March, we've already served over 2,000 kids with dental services in that short period of time. Now, those numbers should triple and quadruple by next year, because we'll start off with the beginning of school year, getting parental consent, and then starting the dental program early in the year, so it's going to grow. It's more important than ever, since we're going to continue these programs, that you call in and make a pledge so that CMN can continue to help the kids in our community.
Thank you, School-Based, for cleaning my teeth.